We are so glad to welcome back our good friend, Dr. Steve Marsh of Cleveland Smiles. And today, he is going to share how you can have a more beautiful smile with a variety of more conservative treatment options. So welcome back to the show, Dr.
Thanks,
Marsh.
Holly. Thank you.
It's great to see you. So we're talking major changes, but not necessarily major procedures. How is that possible? Because I know a lot of you are thinking, what?
Well, so sometimes we have to do a whole mouthful of teeth, veneers, crowns, whatever. Sometimes subtle differences will make a big difference in the way a person looks. And so sometimes it's gum contouring. We use a laser to do that. Sometimes it's reshaping. Sometimes it's bonding. Sometimes it's a combination. And so today I thought we'd talk about some of those things that make a big difference with a little work and not as big an investment for the patient.
Very good. So you need to come gather around your television so that you can see the pictures that we're about to put up, and I'm going to let Dr. Marsh explain exactly what has happened.
So this first patient is somebody, her sister was getting married. She came to me 6 weeks before the wedding. She said, I don't like the way my teeth look. And this sort of uses a lot of the different methods that we're talking about. I talked about gum contouring. Things were uneven. She had a big wide smile, as some people do. She showed her upper teeth and gums. So in that case, we used the diode laser. In about 15 minutes, raised the tissue. The teeth were uneven on the bottom. Those we reshaped. And we also bonded some of those front 4 teeth to give her almost a perfect look. We also did a little whitening, and she was ready for the wedding. And we also took care of her sister, the bride, as well, but didn't need as much work. So we did it in a very conservative 1 appointment, 2-hour session.
That is beautiful, and I'm sure it was happily ever after thanks to you.
Well, we hope so, right?
Yes, yes.
So before and after, so I mentioned gum contouring. So I can't tell you how many people after braces have tissue that actually comes down. So this is a 17-year-old girl. The teeth are aligned nicely. But when she smiled, she said, I'm still not happy with the smile. Can you tell me what it is? I said, it's really that you're showing so much tissue. So what we did was, in about a half hour, we raised the tissue, again, using the laser. The recovery is wonderful, very easy, no pain involved. And suddenly she had a beautiful smile. It's sort of like raising window shades, if you will, to make things even up.
What a great analogy, yeah. It's amazing what the laser does.
Laser does. And we're talking about the laser, so here's somebody didn't like her teeth. She's an attorney, would not smile because of that smile. Oh. And so we raised the tissue again with the gum contouring. And then we actually put porcelain veneers across the front 8 teeth to give her a beautiful smile. And I can tell you she's out there in public now, and she's always smiling.
From ear to ear.
I mean, it was a big life change for her.
I can only imagine how many of your patients leave with tears in their eyes, like tears of joy. They're smiling again.
Right, so thank you. So here's, this is actually the husband of a good friend of mine that I went to high school with. And you can see over the years, they didn't look very good. She wasn't crazy about looking at him across the table. So we actually did a porcelain bridge. Now what doesn't show in this is he actually had a tooth that had periodontal disease. The bone had gone away. The tooth was very loose. So his left front tooth, the viewer's right, had to be taken out. And then we did a porcelain bridge across the front. So sometimes you hear about implants for that. But here, in 2 appointments over about 3 weeks, the tooth had been taken out 6 weeks before. We ended up with a porcelain bridge, and he was ready to go and had a daughter's wedding and looked very good for the daughter's wedding.
Amazing. Okay, and I think this is the last set of photos, I believe?
Yeah, it is the last set. A man who's a pilot, and he said, listen, I'm ashamed of the way I look, ashamed of the way I smile. And like a number of other cases, his wife brought him in and said, let's see what we can do for him. So we ended up giving him these 4 porcelain veneers. We ended up doing more teeth. But again, as we've mentioned before, conservatively, we can work in stages. Sometimes it's a matter of time. It's a function of money.
Is that
that's Ralph?
Him? Oh my goodness.
And
clear for takeoff.
I love that. I hadn't thought of it, but that's exactly right. And that was Ralph with his mouth restored. And again, the hesitant smile at first, and then you see that big, broad, beautiful smile. And he's as kind and personable as that picture shows in the after.
Oh my goodness. Well, speaking of kind, you just described yourself, because this is a gift that, I mean, I can't think of anything better. The gift of smiling, and to not be ashamed of your smile. We should all, you know, have that honor. So you can contact Dr. Marsh. The number is on your television. It's 440-461-1003, or always visit that website, clevelandsmiles.com. Dr. Marsh, thank you so much.
Thanks for having me, Holly.
Yes.